Hello everyone, now let us discuss about CPT coding guidelines for medicine part 5. In the current session, we will be discussing about dialysis, ESRD and gastroenterology. First of all, coming to CPTs related to dialysis. Dialysis can be broadly categorized into two types. Based on whether it is hemodialysis, CPTs are broadly categorized into two types based on whether it is hemodialysis or other dialysis other than hemodialysis. For peritoneal dialysis, hemofiltration or other continuous renal replacement therapies, one set of CPTs are there, and for hemodialysis another set of CPTs are there. Coming to the CPTs for hemodialysis, for single evaluation, if the physician provides single evaluation for hemodialysis, the code is 90935, and if repeated evaluation is performed for hemodialysis, the code is 90937. And further, if indicator method is employed, the code is 90940. We will see the detailed description of these codes in the further session. As of now, for hemodialysis, if it is single evaluation, the code is 90935, and if it is repeated evaluation, the code is 90937. And other than hemodialysis, whether it is peritoneal dialysis or hemofiltration or other renal replacement therapies, for single evaluation, the code is 90945, and for repeated evaluation, the code is 90947. Now, here you can see the various CPTs and the descriptions. The first CPT is 90935. It is coded for hemodialysis procedure with single evaluation by a physician or other qualified healthcare professional. And for hemodialysis with repeated evaluation, you can see the description of 90937. For hemodialysis procedure requiring repeated evaluation or evaluations with or without substantial revision of dialysis prescription, with or without substantial revision of dialysis prescription, the code is 90937. And finally, 90940 is coded for hemodialysis axis flow study to determine the blood flow in grafts and arteriovenous fistulae by an indicator method. In order to study the axis flow study of hemodialysis, the code is 90940. Next, coming to dialysis procedures other than hemodialysis. As we have discussed earlier, for dialysis procedures other than hemodialysis, for example, peritoneal dialysis, hemofiltration or other continuous renal replacement therapies, for single evaluation, with single evaluation by a physician or other qualified healthcare professional, the code is 90945, and for repeated evaluations, the code is 90947. And for home infusion of peritoneal dialysis, you need to use 99601 and 99602. Now, coming to guidelines, these codes are used for inpatient end-stage renal dialysis patients and non-ESRD procedures. These codes are used for inpatient ESRD and non-ESRD procedures, and also for outpatient non-ESRD dialysis services. ESRD is nothing but end-stage renal disease. And these codes are reported to describe the hemodialysis procedure with all E&M service related to patient renal disease. These codes can be coded along with the E&M codes, and here you need to use 25 modifier to the E&M codes. And the key term whenever we see a hemodialysis question is they will mention AV graft. This is one of the key term. Now coming to other hemodialysis. For example, peritoneal dialysis, hemofiltration, other continuous renal replacement therapies. For all these cases, for single evaluation, the code is 90945, and for repeated evaluation, the code is 90947. Now here, let us see an example. A patient with ESRD and hypertension stage 5 and secondary parathyroidism is evaluated by the physician. The patient is evaluated by the physician and receives peritoneal dialysis. The physician evaluates the patient once before the dialysis. So this is considered as single evaluation, and the patient is receiving peritoneal dialysis. For peritoneal dialysis and single evaluation by physician, the correct code is 90945. Now coming to other ESRD services. What is the criteria before selecting a code? For ESRD services, that is end-stage renal disease services, the first criteria is age. The codes are based on age. Second criteria is location of the service, whether the service is provided at the physician office or home. Third scenario is number of times the service is rendered. There are codes for per month, per day, or 2 or 3 times in a month. Based upon number of services also the codes are categorized. So the 3 criteria are, first thing is age, second thing is location, third is number of services per month. For example, ESRD services provided by physician at home for 5 days on 20-year-old patient. In this case, the correct code is 90970. 5 units of 90970 must be coded. Because 90970 is given for home ESRD services and the patient must be older than 20 years. And third criteria is it is provided per day. So for 5 days you need to provide 5 units of 90970. Now here we can see the complete set of ESRD service codes. The first criteria, as we have discussed earlier, is age. Here you can see the codes are based on age. Second criteria is location, whether it is office or home. And third criteria is whether the service is provided per month or per day. For patient less than 2 years of age, if 4 or more face-to-face visits of ESRD services are provided in the physician's office, the code is 90951. For 2 to 3 face-to-face visits in physician's office, the code is 90952. And for 1 face-to-face visit, the code is 90953. The patient is less than 2 years of age and the service is provided once per month at home, the code is 90963. And if the code is provided, if the service is provided per day, if the patient is less than 2 years of age and ESRD services are provided per day, the code is 90967. If it is provided for per month at home, the code is 90963. This is for less than 2 years of age. Next age group is 2 to 11 years. For 4 or more face-to-face visits in physician's office, the code is 90954. For patient in the age group 2 to 11 years and 4 or more face-to-face visits of ESRD services as provided in the physician's office, the code is 90954. Per month at home, if the patient age group is between 2 to 11 years, the code is 90964. And for per day, it is 90968. Next, coming to 12 to 19 years. If the patient age group is between 12 to 19 years, for 4 or more face-to-face visits, the code is 90957. For 2 to 3 face-to-face visits, it is 90958. And for 1 face-to-face visit, the code is 90959. For 12 to 19 years of age, the ESRD services are provided per month at home. The code is 90965. And for per day, irrespective of the location, the code is 90969. And finally, 20 years or older. For 4 or more face-to-face visits, the code is 90960. For 2 to 3 face-to-face visits, it is 90961. And for 1 face-to-face visit, it is 90962. And the patient is 20 years or older, per month. The ESRD services are provided per month at home. The code is 90966. And for per day, the code, whether it is home or physician's office, it is immaterial. These codes are given per day. For 20 years or older, if the ESRD services are provided per day, the code is 90970. Now let us see an example. ESRD related services are initiated on July 1st for a 57-year-old male. Age is greater than 20 years. On July 11th, he is admitted to the hospital as an inpatient and is discharged on July 27th. He had a complete assessment and the physician or other qualified healthcare professional has performed two face-to-face visits prior to admission. Here, two face-to-face visits prior to admission and another face-to-face visit occurs after discharge during the month. So here, total 3 face-to-face services are provided at the physician's office. Here, the ESRD services are initiated on July 1st. So, one service is provided here. The healthcare physician performed two face-to-face visits prior to admission. That is, before July 11th, the patient has already undergone two face-to-face visits of ESRD related services in physician's office. Don't get confused. And another face-to-face visit occurs after discharge during the month. So here total 3 face-to-face visits are provided at physician's office. So in this example, the correct answer is 90961 is reported for 3 face-to-face visits, outpatient visits, and report the inpatient E&M services as appropriate. For admission and discharge, you need to report inpatient E&M services as appropriate, and dialysis procedures rendered during the hospitalization, that is from July 11th to 27th, should be reported as appropriate based upon the respective dialysis codes. Now coming to other dialysis procedures. 90989 is coded for dialysis training patient including helper when applicable. Any more complete codes. For dialysis training of whether it is patient or helper, the code is 90989. The next is 90993. Dialysis training patient including helper wherever applicable. Any more course not completed per training session. For completed course, the code is 90989. If the course is not completed per training session, you need to code 90993. Next, for hemoperfusion, example with activated charcoal or resin, the code is 90997. And for unlisted dialysis procedures, inpatient or outpatient, the code is 90999. Next, coming to gastroenterology. This is the final topic in this session. Coming to gastroenterology, here we will be discussing esophageal acid reflux study along with other codes also. Esophageal acid reflux test is important. The code range is 910342 to 91038. The codes are based on GERD test. Here a catheter with a pH electrode is placed into the esophagus either through nares or swallowed to measure the intraesophageal pH. The key terms to look for questions are nasal catheter, mucosal attached electrode and intraluminal electrode. These are some of the key terms that you must go through while studying the question. Now coming to gastroenterology CPTs. The first CPT is 91010. It is coded for esophageal motility study with interpretation and report. Motility study nothing but manometric study of the esophagus and or gastroesophageal junction. And if it is performed along with the stimulation or perfusion, then you need to use this add-on code 91010. Along with 910, the add-on code 91013 must be coded if stimulation or perfusion is performed additionally. The next code is 91020. It is coded for gastric motility studies. Next is 91022. It is coded for duodenal motility studies. Next is 91030. It is coded for esophagus acid perfusion, that is Bernstein test for esophagitis. The next is 91034. It is coded for esophagus gastroesophageal reflex test with nasal catheter pH electrode placement, recording, analysis and interpretation. If esophagus gastroesophageal reflex test is performed with mucosal attached telemetry pH electrode placement, then you need to code 91035. For mucosal attached electrode, the code is 91035. And for simple gastroesophageal reflex test with nasal catheter pH electrode, the code is 91034. The next is 91037. It is coded for esophageal function test, gastroesophageal reflex test with nasal catheter, intraluminal impedance electrode placement, recording, analysis and interpretation. For prolonged esophageal function test, that is greater than 1 hour up to 24 hours, the code is 91038. The next is 91040. It is coded for esophageal balloon distension study diagnostic with provocation when performed. The next is 91065. It is coded for breath hydrogen or methane test, that is for detection of lactose deficiency, fructose intolerance, bacterial overgrowth or orocecal gastrointestinal transit. In order to detect all these things, if breath hydrogen or methane test is performed, the code is 91065. Coming to next CPT, it is 91110. It is coded for gastrointestinal tract imaging intraluminal. Example, capsule endoscopy, esophagus through ileum. This is the key term. Esophagus, if it is esophagus through ileum, the code is 91110. For simple gastrointestinal tract imaging intraluminal esophagus with interpretation and report, the code is 91111. If it is esophagus through ileum, the code is 91110. If it is simply esophagus, the code is 91111. The next code is 91113. That is coded for gastrointestinal tract imaging intraluminal colon with interpretation and report. The next is 91112. That is for gastrointestinal transit and pressure measurement, stomach through colon, wireless capsule with interpretation and report. Next CPT is 91117. It is for colon motility study, manometric colon motility study, minimum 6 hours continuous recording including provocation test, for example meal, intracolonic balloon distension, pharmacological agents if performed with interpretation and report. And next is 91120. It is coded for rectal sensation, tone and compliance study. That is the response to graded balloon distension. The next is anorectal manometry. The code is 91122. Next, coming to CPTs related to gastric physiology. The first CPT is 91132. It is coded for electrogastrography diagnostic transcutaneous. And for electrogastrography with provocative testing, the code is 91133. The next CPT is 91200. It is coded for liver elastography. For liver elastography, mechanically induced shear wave without imaging with interpretation and report, the code is 91200. Now let us see an example. 49-year-old has severe episodes of esophageal reflux and underwent a gastroesophageal reflex test to measure the pH balance. The test was performed with a mucosal attached capsule. Here the key term is mucosal attached capsule. The physician provides interpretation and report as gastroesophageal reflex. What codes are to be coded here? If you see the description of gastroesophageal reflex test. There are two CPTs, 91034 and 91035. With the mucosal attached telemetry pH electrode. This is nothing but mucosal attached capsule. With mucosal attached telemetry pH electrode placement, recording, analysis and interpretation, the code is 91035. For esophagus, gastroesophageal reflex test with mucosal attached telemetry pH electrode placement, recording, analysis and interpretation, the correct code is 91035. Because in our question the key term mucosal attached capsule is there, you need to code 91035 as the correct answer. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.